Hello everyone, welcome to AACCM e-learning channel. Myself, Dr Ankit Shrivastava, will be dealing with the topic today, which is hyponatremia. So we talk about hyponatremia. We know that the normal serum sodium levels are 135 to 145 milliequivalent per liter. If the serum sodium levels are less than 135 milliequivalent per liter, we term this as hyponatremia. Now, if we check that the serum sodium levels are less than 135 milliequivalent per liter, we have to check that why this particular thing is happening in the human body. To know this, we should know or remember that any ion disturbance corresponding to sodium levels in the body, it is due to a change in the water balance of the body. To know about water balance, we should know that it actually works in view of a triangle which is having three limbs or three sides. Every side is equally important in the water balance, and they are the ADH, the hypothalamic osmoregulation, and the kidneys, which will tell us about the countercurrent mechanisms of the body. Because of this, they will be maintaining a normal levels of serum osmolality, which is almost 275 milliosmol per kg. If there is less than 270 milliosmoles per kg of serum osmolality, that means there is excess water in the human body, there is dilution of urine, and excretion of water via urine. Also, if there is levels of serum osmolality which is more than 280 milliosmoles or 290 milliosmoles per kg, that means the body water is concentrated, and that is why there is increased release of antidiuretic hormone, increased levels of thirst, and there is water retention. These two processes will maintain a normal levels of sodium in the body, and because of these two reasons, the levels of sodium in the body remains normal. Right. So now let's see what is the most the most osmotically active organ in the human body. That is, as we all know, it is brain. Right. So if any changes happen in the osmolality of the body, the first manifestation will be seen in the brain, or the body will show CNS symptoms most probably. Right. So what happens that if there is serum osmolality, it is varying sometimes. Okay, so what happens, the water will shift inside the cell or inside the neuron. This will cause what? Cell swelling, right? And this will be seen in case of hyponatremia. right? Most commonly the herniation of brain or cerebral edema, right? This is the scenario. Similarly, if water shifts out of neuron, right, that will cause cell shrinkage or tearing of the meninges, will cause hemorrhage. This will be seen in case of hyponatremia, right? So anything which is related to osmotically active organ in the body, that is brain, the water will shift inside the neuron. There will be cell swelling, ultimately causing herniation or cerebral edema. Later, supposedly, if the water shifts out of the neuron, if the osmolality of the is too high, that will cause cell shrinkage, ultimately causing tearing of the meninges and causing hemorrhage. These are the symptoms which are seen in case of hyponatremia or hyponatremia. And one more thing is important here, that the severity of the clinical symptoms, right, they often depends on the acuity of the disturbance and not just the magnitude, right? So the more acute is the condition, I'm talking about the sodium levels here, right, slower correction is required, right? So this is the thing which we should remember, okay? Because what happens, the neurons generally, they take some time to adapt to these kind of gradual changes in the body. Suppose somebody is having hyponatremia or any kind of iron disturbance in the body, brain generally takes around 48 hours, okay? This thing we should remember. So in this kind of 48 hours duration, we will discuss this when we discuss about the chronicity of the hyponatremia later, okay? Now suppose this is the thing which I'm talking about, the general symptoms or general conditions about the hyponatremia. Okay, the definitions of hyponatremia, what about the water balance, how osmotically active things, osmotically active organs work out, okay, and what happens when there is cell swelling or cell shrinkage. Okay, now let's talk about the evaluation of hyponatremia. Okay, so to evaluate hyponatremia, one should remember that you have to check for serum osmolality, right? This is the first step. We should check for the serum osmolality. Okay, now to see whether it is normal, I am taking the normal here as 280 to 290 milliosmol per kg. If it is low, or if it is high, right? So low will be less than 280, high will be more than 290. Okay, so if somebody is having, you only think this, that if there is normal serum osmolality, okay, then what is the situation here? That we should first confirm this, that if there is a truly hypotonic state in the body, okay, by checking the serum osmolality. Once you check this, if it is coming normal, it will show us two situations here. Hyperlipidemia hyperproteinemia, okay, and this will tell us about one state, pseudo hyponatremia. Okay, and if the osmolality is high, right, this will be seen in situations like hyperglycemia or infusions of glycerol, mannitol. In this state, what happens is the osmolality of the serum gets high. Okay, so because of that, what will happen? There will be a low sodium state possible in that situation there. So this will tell us about hypertonic hyponatremia. Now, the serum osmolality is low. Okay, in this situation, what are we supposed to do? This is a tricky thing here. We have to check for volume status. Okay, obviously the volume will be either high, we call it hypervolemic, either it will be low, we call it hypovolemic, or either it will be normal, or we call it euvolemic. Okay, so the terminology here will tell us about either it will be hypervolemic hyponatremia, hypovolemic hyponatremia, or euvolemic hyponatremia. Hypervolemic states like CCF or congestive cardiac failure, nephrotic syndrome, decompensated liver failure. In these three situations, what will happen? I'll explain this in the next video, how hypervolemic states in this kind of situations will affect the sodium levels in the body. As of now, you should just remember that in hypervolemic states like CCF, nephrotic syndrome, and decompensated heart failure, serum osmolality will remain low. Okay, hypovolemic hyponatremia, you have to check for urinary sodium concentration. Okay, this will be either less than 15 or more than 20, right? If there is more than 20 urinary sodium, it will account for the renal losses in the body. The renal losses because the kidney is working properly at that point of time, so urinary concentration of the sodium is high. In these situations, it will come as examples like thiazide diuretics, or adrenal insufficiency, or cerebral salt wasting syndrome, or we call it salt losing nephropathy. Okay, we talk about extrarenal losses, or when the urinary sodium is less than 15. We all know the examples here. Extrarenal losses, which will account for hypovolemic hyponatremia. Here, the volume is going down in case of suppose vomiting, diarrhea, fistulas, right? Burns, this will also cause the same thing, hypovolemic state, right? Peritonitis, perforations. Okay, these are situations in which we'll see less than 15 milliequivalents per liter concentration of urinary sodium, right? And in euvolemic state, the examples will be SIADH, hypothyroidism, decreased cortisol. Okay, we are explaining this how this particular situations comes into play, right? So as of now, we have to check for serum osmolality if we have to assess for hyponatremia. Either it should be normal, it should be low or should be high. If it is normal, you have to see the situations as pseudo hyponatremia, examples being hyperlipidemia and hyperproteinemia. If it is low, you have to check for volume status, as we have seen. It will be divided into hypervolumic, hypovolemic and euvolemic states. If it is high, it will be due to either mannitol or glycerol IV infusions, or hyperglycemia, that will be termed as hypertonic hyponatremia. Right. So now, as of now, we are discussing this. In the next video, I'll be discussing about all these discussions and the treatment part of the hyponatremia, how to specifically treat hyponatremia in ICU, and with some certain examples. Okay. Till then, have a good time, read well, subscribe to our channel. Thank you so much.